Welcome back. In health headlines, the latest weight loss and diabetes drugs are really revolutionizing people's lives. And now another option is on the horizon that does not require a needle. Eli Lilly recently announced that it has developed a pill, saying that it's as strong as Ozempic.
It activates that GLP-1 receptor in your body.
So people can potentially expect the same kinds of weight loss taking this pill?
That's the hope.
Well, they are so confident in the pill that it's already being manufactured. FDA approval could be as soon as next year. Joining me now is Dr. Sonal Haerter with Dignity Health Medical Group, and she's also a board-certified obesity medicine specialist. Sonal, this could be a game changer. I mean, in the pill form, especially for people who are a little squeamish with the needle.
Absolutely.
So tell us about how, this could be just as effective.
Okay, so this study, on this medication was about 40 weeks. They had 559 people with type 2 diabetes, and they looked at weight loss and management of sugars and diabetes markers. And what they found was these people who were on this medication is called orforglipron, long name, but the weight loss medication, just like Ozempic, actually resulted in about 16-pound weight loss at 40 weeks. It also resulted in lowering blood sugars to about 1.2 to 1.6%, and 65% patients who were taking these medications had blood sugars in normal range. So
wow.
This is amazing because, again, not everybody likes injecting medications. With the injectable pens comes refrigeration, all that hassle. So taking a pill every day might be something that a lot of people could do on a easier basis.
Okay, so you hit my next question because I was wondering, with the injection, it's usually like what, once a week?
Once a week.
So is this pill then an everyday pill?
It's an everyday pill, yes.
Oh, okay.
And so I think they are trying to seek FDA approval for obesity later this year, as well as for diabetes earlier next year. So that's the plan so far.
Yeah, I know. Again, it's still early, but we'll wait and see.
And we do not know what the price is going to be. They have not released because that often becomes a big obstacle for most of our patients.
Yeah, that's a big factor.
Correct.
All right, moving on now. So this is interesting. For a lot of people who are taking these GLP-1s, these weight loss drugs, there comes a certain point where they hit a plateau.
Correct.
Why is that?
Okay, so weight plateau is a very interesting phenomenon. And here's what I tell my patients. It's not 1 or 2 weeks. It's about 4 weeks or more.
Wow.
So if you're not noticing any changes in your weight despite maintaining a very good regime, then that's probably plateau. Now, here's what happens. This can be part of your natural weight loss progression. Because if you think about it, as you're getting closer to your ideal body weight, your weight loss slows down.
Right.
Also, there's something called metabolic adaptation. Your body starts to adapt because it's trying to save the energy as you lose more and more weight. Now, few things that people could take a look at is calories in and calories out.
Okay.
We know that if this equation changes, we have to kind of look at, are you consuming more calories than what you are spending? Because that seems to be the reason why people, plateau. One more thing, especially if patients or people are following a good diet and a good workout regime, but still hitting that plateau, maybe you're gaining more muscle and there's less fat to lose.
Which
and I think
muscle we know weighs more than fat.
Absolutely.
Yeah.
And it's good. It's a good thing to gain muscle. And that's why not just weighing scale, but body composition is so important to look at whether you're plateauing or whether you're actually gaining muscle, and losing fat.
Right.
And so that's one. I think lack of sleep and stress. What sometimes I emphasize is that something change in your lifestyle. Are you traveling? Are you not sleeping as well? Because we know there are studies that sleep deprivation increases your appetite signals. So people crave more, they snack around more. And sometimes people don't realize, but snacks can be calorie dense.
Yeah.
So maybe you're eating the same meals, but maybe there are more snacks, maybe there are more sweetened beverages.
Right.
It's graduation season, so sometimes I say, how is your schedule on the weekends?
Okay.
Because maybe you are really good about maintaining your schedule on the weekdays, and weekends could be very off, and that can actually cause not able to lose weight.
Yeah, so many factors. Okay, so when you hit this plateau for up to 4 weeks, then what? How do you kind of break through?
Okay, so number one, reassess your habits. Like, take a look at, has anything changed in your day-to-day life? And it's not always exercise at the gym, but how active are you in your day-to-day life? For example, I see a lot of people who actually have desk jobs or do not move very much
very
all day
sedentary,
long.
yeah.
So although they are working out at the gym 30 minutes or 150 minutes per week, they're not really moving all day long, and that can actually impact your metabolism. So oftentimes I will say, could you add 500 more steps every day? 1,000 steps. Or can you do 15 squats every hour? If you're at a desk, just get up and do 15. We know that even as little as that can lower your blood sugars.
I mean, your coworkers might think you're a little nuts.
Correct.
But yeah,
Well,
tell me, yeah.
I often just disclose it to everybody in my group and say, I'm doing 15 squats. It's actually contagious. A lot of people do that. Also, food logging. Food logging is not for everybody. It's not my favorite, but there are some people who could track their food habits for a week or 10 days just to see their pattern.
Yeah.
It's important to look at, because sometimes we underestimate how many calories we are consuming, right?
Right.
And obviously sleeping, your stress levels,
huge,
those.
yeah.
And last but not the least, if you are on a medication, is this an optimal dose? This is a conversation you need to have with your doctor about, can we go up on our dose? If this is a true weight plateau and you are being consistent with your habits, eating and working out, now it's time to look at your medication dosage and see, is there some room to go up on it?
Okay. Excellent advice. All right, Sonal, thank you so much. Glad to have you back.
Thank you so much.
Okay, now here's Ginger with your weather impact forecast.